the intent of the bill was to look at how we could request a block grant from the federal government of the existing TennCare money from the federal government. This is almost $7 billion, plus the state's 3.3, and how we could have better control within that $10.3 billion to bend the cost curve for the current TennCare population, and find a way as we bend that curve and reduce costs that we could insure other people without adding to the debt of the federal government. That's what the original intent of that bill was. As I started learning more about just how broad the caption was and some of the things that could happen, I wanted to kind of narrow that down a little bit more to make sure it stayed within the context of what we were trying to do. I believe because of just the short time frame we have left, it's probably done for this session, but I'm not giving up because I do believe there's another way that we can move forward to help people in our community, but also to control the cost. So as we can bend those cost curves and bring the cost of healthcare down for everybody and allow the economy to catch up, it's just putting more money back in the pockets of every Tennessean. And we can find ways, like I said, in the committee, that we use TennCare as a safety net that when things happen and people need to jump on it, they can, but then we're giving them that avenue to stay on their feet and keep moving forward and provide for themselves. And continue to provide their health care. It's just giving the control back, giving the control to the state. TennCare is recognized as one of the best managed Medicaid programs in the country. And in Tennessee, we have found a way to do quite a bit with very little. And I think the greater control we have, where we can adapt more quickly in the state to make changes to that, then we would be able to control those costs, find a way to help hopefully cover more people, to give them a way to get on their feet, some of the healthy incentives that Insure Tennessee did have, look at taking some of those positive pieces but applying to the whole TennCare population to see if we can't start modifying behaviors in a larger chunk of people. So as we have a healthier population, they're working more. We have more people to put on, for jobs as we continue to try and attract those jobs here. And again, as you bend that cost curve, slow the rate of growth, the economy catches up, which means people are paying less out of their checks for healthcare cost.